Hello, good morning. I am Dr. Manas Ranjan Tripathy, Senior Consultant Laparoscopy, General Surgery and Proctology. Welcoming you all to my video awareness program from Garden City, Bangalore. Hope all of you are doing well. Today I'll be discussing with you very briefly about a very common condition which affects mostly the middle-aged people, that is a pilonidal sinus. Now, what is a pilonidal sinus? What difficulties does it present? How are the patients affected, and what are the ways of treatment? So today we'll be discussing just briefly about what a pilonidal sinus actually is. Pilonidal sinus means a small tunnel beneath your skin containing hairs. Pilonidal means nest of hairs. Sinus, anywhere in the body, is a small epithelialized tunnel which usually originates deeper in the skin with the focus of infection and gradually travels towards the skin surface, and it has an opening on the skin surface. So any opening on the skin surface which is blindly ending deep to the skin is called a sinus. Pilonidal sinus is essentially a sinus tract filled with debris and hair material. Presence of hair is usually characteristic of a pilonidal sinus. So where all does this pilonidal sinus happen in our body? So usually the most commonest location is in the intergluteal cleft or the lateral cleft, that is between the two buttocks. That is the location of a pilonidal sinus in more than 95% cases. Although it has been seen in between the web space in the fingers or in the axilla, sometimes in the navel also, but usually, unless otherwise specified, pilonidal sinus means in the intergluteal cleft region only. So how does a sinus form? See, there are many theories, although we don't know the exact cause how it happens, but we definitely have an idea about how the progression of the disease is. Sometimes this may be hereditary. It happens such that the anatomy, the development of the person is such that the hair in the intergluteal region is tending to grow inwards. That's why many people develop this in families. So what happens basically is, because of friction, because of hair growth in the intergluteal cleft region, because of the local pressure on the hair follicles, what happens is the direction of hair growth happens inwards, and hair follicles start to grow inwards, and superficial pits which have been formed because of friction or pressure, because of the ingrowth of hair, they tend to become deeper and deeper, and consequently they form sinus tracts filled with hair material and debris, which in turn gets infected from time to time, giving result to symptoms. Even though people have these tracts or these pits from small age, but they usually don't manifest unless there is sufficient growth of body tissue and hairs around that place. So who are the people who normally get these sinuses? Usually anyone can get the sinus, but more often it is seen in patients who sit for prolonged period of time, who are usually obese with lot of hair, especially in the gluteal region if the hair growth is more, and if there is a lot of sweating in the people, and sometimes as I have already mentioned, the hereditary preponderance is also there for pilonidal sinus disease. So in short, it's a superficial skin and a deep tissue involvement with a sinus tract containing hair follicles, which causes infection again and again, resulting in troublesome symptoms sometimes. So this is what a pilonidal sinus means. In our subsequent videos, we will discuss with you how does the sinus usually present and what are the treatment options we have to deal with such a sinus disease. Thank you all for your patient listening. We'll see you soon again.